Good morning, everyone, and welcome. I'm excited to present to you today on the topic of understanding of cardiovascular technology. This presentation will focus on the instrumentation used in the catheterization laboratory, an essential area in cardiovascular care. My name is Irshad Ahmed, a medical lab technologist at All India Institute of Medical Sciences in New Delhi. Over the next few minutes, we'll explore the key tools and techniques that enable us to diagnose and treat heart conditions effectively. Let's get started. Welcome to our overview of the Cardiac Catheterization Laboratory, often called the Cath Lab. This specialized facility plays a vital role in diagnosing and treating heart conditions. It allows us to assess how well the heart is functioning, identify any blockages in the arteries, and perform interventions when needed. The Cath Lab is equipped to carry out a variety of minimally invasive procedures, which means less trauma for patients and quicker recovery times. These procedures help us avoid more invasive surgeries like open heart surgery, making treatment safer and more efficient. This is especially critical in emergency situations, where every second counts in saving a patient's life. Overall, the Cath Lab is a cornerstone of modern cardiovascular care, combining precise diagnostics with timely interventions to improve patient outcomes. Now, let's take a closer look at the different types of procedures performed in the Cath Lab. First, we have diagnostic procedures, which are essential for identifying issues within the heart. For example, coronary angiography is a common test used to detect blockages in the coronary arteries, helping us understand the extent of the problem. Moving on to interventional procedures, these are more treatment-focused. Procedures like angioplasty and stenting are performed to open up blocked arteries, restoring blood flow and preventing further heart damage. These interventions are often done immediately after diagnosis to improve patient outcomes. We also have electrophysiology studies, which are crucial for diagnosing and treating abnormal heart rhythms or arrhythmias. These procedures help us pinpoint the source of irregular heartbeats and guide us in applying appropriate treatments. Now, let's talk about the key players in the Cath Lab. Cardiologists are the specialists who perform these procedures and make critical decisions during each case, ensuring everything is tailored to the patient's needs. Nurses play a vital role by assisting with setup, patient preparation, and managing paperwork, ensuring the process runs smoothly and safely. Technologists are also essential. They help set up and monitor the equipment, keep a close eye on every event during the procedure, handle machine maintenance, and stay alert for any emergencies. Their vigilance ensures that everything operates seamlessly, which is crucial for patient safety and successful outcomes. All these roles come together to create a coordinated team effort, centered around delivering precise, effective cardiovascular care in the Cath Lab. Let's take a closer look at the key components of a cardiac cath lab. First, we have the imaging systems, which include high-resolution fluoroscopy and X-ray machines. These tools provide real-time imaging of the coronary arteries, allowing us to see exactly what's happening inside the heart during procedures. Next, we rely on catheters and guide wires. These are thin tubes that we carefully insert into the arteries to diagnose or treat various heart conditions. They are essential for navigating the complex vascular pathways safely and accurately. Then there's the hemodynamic monitoring system. This equipment measures vital signs like heart rate and blood pressure throughout the procedure, giving us critical data to ensure patient safety and optimal outcomes. Radiation safety equipment is also vital. Lead aprons, shields, and dosimeters help protect both staff and patients from unnecessary radiation exposure, which is always a concern in these procedures. As for specific procedures, coronary angiography is one of the most common. It allows us to visualize blockages or abnormalities in the coronary arteries. We also perform balloon angioplasty to open narrowed arteries and stent implantation to keep them open long-term. Other important interventions include valve repairs and replacements, catheterization studies, pacemaker placements, and electrophysiology studies. Each of these plays a crucial role in managing different heart conditions. Altogether, These components and procedures highlight how a cardiac cath lab is equipped to diagnose and treat a wide range of cardiovascular issues effectively and safely. Now, let's talk about the function of this system. It generates real-time images of the heart and blood vessels, which is crucial during many cardiovascular procedures. When it comes to types, there are mainly fixed systems, which can be ceiling-mounted or floor-mounted, and mobile C-arms that offer greater flexibility and can be moved to different positions as needed. Moving on to key features, one of the most important is the digital flat panel detectors. These provide high-quality images, but also help reduce radiation exposure, which is always a priority for patient safety. Then, there's fluoroscopy, which is essentially continuous X-ray imaging used to guide catheters during procedures. It allows for real-time visualization, making complex interventions safer and more precise. Finally, angiography is another critical component. It captures still images for detailed analysis after the procedure or for diagnostic purposes. Altogether, these features and types work together to enhance the effectiveness and safety of cardiovascular imaging, supporting clinicians in making accurate diagnoses and performing successful interventions. Let's take a closer look at catheters and guide wires, which are essential tools in cardiac procedures. Catheters are thin, flexible tubes that we insert into blood vessels to reach the heart. They come in different types depending on their purpose. Diagnostic catheters are primarily used for injecting contrast media, which allows us to visualize the coronary arteries clearly on imaging. On the other hand, interventional catheters, such as balloon catheters and stent delivery catheters, are used during therapeutic procedures to treat blockages or other issues. Now, guiding these catheters into the right position requires the help of guide wires. These are very thin, flexible wires made from materials like stainless steel or nitinol. To make their insertion smoother and minimize trauma, they are coated with hydrophilic material, which helps them glide easily through blood vessels. All of these tools are designed to work together seamlessly, enabling us to perform both diagnostic and therapeutic interventions effectively and safely. Their design and functionality are central to the success of minimally invasive cardiac procedures. Now, let's talk about intravascular ultrasound, or IVUS for short. The main purpose of IVUS is to provide us with detailed cross-sectional images of the inside of blood vessels. This allows us to see exactly what's happening within the arterial walls, which is crucial for accurate diagnosis and treatment planning. The way IVUS works is quite fascinating. It uses high-frequency sound waves, similar to ultrasound imaging used in other medical fields, to produce these detailed images. When the ultrasound probe is inside the vessel, it can visualize the walls and the lumen, giving us a clear picture of the vessel's structure. This technology is particularly helpful when assessing the extent of arterial blockages. It helps us see how severe the narrowing is and whether there are plaque buildups or other abnormalities. Additionally, IVUS guides us during procedures like stent placement, ensuring we position the stent correctly and achieve the best possible outcome for the patient. Overall, IVUS is a powerful tool that enhances our ability to evaluate and treat vascular conditions more precisely, aligning perfectly with our goal of improving patient care through advanced imaging. Let's take a closer look at the fractional flow reserve, or FFR, system. This tool is essential because it helps us measure pressure differences across coronary artery blockages, which is key to understanding how severe these obstructions really are. The main components of the FFR system include pressure guide wires and a monitoring system. The guide wire is inserted into the coronary artery, and it measures the pressure both before and after the blockage. The monitoring system then interprets these pressures to give us meaningful data. The primary use of FFR is to determine whether a coronary artery stenosis, basically a narrowing, is significant enough to warrant intervention, such as stenting. This helps us make more informed decisions, ensuring that we only proceed with invasive procedures when truly necessary. Overall, the FFR system integrates pressure measurements into our diagnostic process, aligning with our goal of providing precise, patient-specific care. It's a valuable tool that enhances our ability to assess coronary health accurately. Now, let's take a closer look at the electrophysiology equipment we use during these procedures. First, we have the electrophysiology catheters. These are specialized tools that help us map the electrical activity of the heart and target specific areas causing arrhythmias for treatment. They are essential for precisely locating the problem spots. Next, we use a 3D mapping system. This technology creates a highly detailed, three-dimensional map of the heart's electrical signals. It's like having a GPS for the heart's electrical pathways, which greatly improves our ability to identify abnormal areas accurately. Finally, we have the ablation methods, cryotherapy or radiofrequency ablation. These are the treatment techniques we employ to eliminate irregular heart rhythms. Cryoablation uses extreme cold to disable problematic tissue, while radiofrequency ablation uses heat. Both are effective ways to restore normal heart rhythm. Together, these tools and techniques form the core of our electrophysiology approach, enabling us to diagnose and treat arrhythmias with precision. They highlight how advanced technology supports our goal of improving patient outcomes through targeted, minimally invasive interventions. Now, let's take a closer look at the hemodynamics monitoring system. Its primary purpose is to keep an eye on the patient's cardiac function and various hemodynamic parameters that are crucial for assessing their overall cardiovascular status. By monitoring these parameters, clinicians can make more informed decisions about treatment and interventions. The system measures several key parameters. First, blood pressure, which tells us how effectively the heart is pumping blood through the arteries. Then, heart rate, which indicates how fast the heart is beating. Oxygen saturation is also vital because it shows how well the blood is carrying oxygen to the tissues. Lastly, cardiac output, which is the amount of blood the heart pumps each minute. This is a critical indicator of cardiac performance. Now, to make these measurements possible, the system relies on some essential components. Transducers are used to convert physiological signals into electrical signals that can be interpreted by the system. Pressure tubing connects these transducers to the patient, transmitting the pressure changes accurately. And all of this information is displayed and monitored on a central monitoring console, which provides a real-time overview of the patient's hemodynamic status. Connecting all these parts together allows us to continuously assess and respond to the patient's changing condition, making the hemodynamics monitoring system a vital tool in critical care. It's an excellent example of how technology supports patient management and improves outcomes. Let's take a closer look at the contrast injection system. These automatic contrast injectors are designed to deliver precise amounts of contrast media, which is crucial for achieving better visibility of the coronary arteries during angiography. The key here is accuracy. By controlling the amount of contrast, we can obtain clearer images and more accurate diagnoses. One of the main advantages of these systems is their adjustable flow rate and volume. This flexibility allows us to tailor the injection parameters to each patient's specific needs, ensuring optimal imaging results. Additionally, these injectors can be controlled remotely, which is a significant safety feature. By doing so, we reduce the operator's exposure to radiation, a vital consideration in the Cath Lab. Overall, this system enhances both the safety and the quality of the procedure, aligning with our goal of improving patient outcomes while maintaining operator safety. Let's talk about some essential radiation safety equipment that helps us protect ourselves and our patients during imaging procedures. First, we have lead aprons and shields. These are worn by staff to significantly reduce exposure to radiation when performing X-ray and fluoroscopy. They act as a barrier, minimizing the radiation that reaches our bodies. Next, there are thyroid shields and lead glasses. The thyroid gland is particularly sensitive to radiation, so wearing a thyroid shield provides crucial protection for that area and the neck. Lead glasses, on the other hand, protect our eyes from scatter radiation, which can be a concern during these procedures. We also use X-ray attenuating drapes, which are placed over the patient to help minimize their exposure to radiation. This not only safeguards the patient, but also helps contain scatter radiation. Finally, radiation monitoring devices are vital. Personal dosimeters, or TLD batches, are worn by staff to track our exposure levels over time. These devices ensure that we stay within safe limits, providing an extra layer of safety for both staff and patients during imaging procedures. All of these tools work together as part of our overall safety strategy, reinforcing the importance of protecting ourselves and those we care for while performing necessary imaging. Let's talk about defibrillators, which are crucial tools in emergency situations. Their main purpose is to deliver an electrical shock to the heart, with the goal of restoring a normal rhythm. This is especially important during life-threatening arrhythmias such as ventricular fibrillation or ventricular tachycardia, where the heart's rhythm becomes chaotic and ineffective. Now, there are different types of defibrillators. One common type is the automated external defibrillator, or AED. These devices are designed to analyze the heart's rhythm automatically and then deliver a shock if it detects a dangerous pattern. They're user-friendly and often used by first responders and even by laypeople trained to assist in emergencies. On the other hand, we have manual defibrillators, which are typically used by healthcare professionals. These devices allow trained personnel to assess the heart's rhythm themselves and manually decide when and how to deliver shocks. This gives them a greater level of control, which is essential in complex situations. Connecting this to our overall theme, understanding the different types of defibrillators and how they work is vital because prompt and appropriate use can be the difference between life and death in cardiac emergencies. Now, let's take a closer look at the emergency crash cart. This is a crucial mobile unit that contains all the essential medications, tools, and equipment needed for resuscitation and managing critical emergencies. Its design allows us to respond quickly and efficiently in high-pressure situations. Starting with airway management devices, these include endotracheal tubes, laryngoscopes, bag valve masks, and oxygen masks. Having these readily available means we can secure the airway promptly and ensure the patient gets enough oxygen, which is vital during emergencies. Next, we have the medications. The cart stocks critical drugs like epinephrine, atropine, amiodarone, and nitroglycerin, along with anticoagulants, sedatives, and other emergency medicines. These medications are essential for treating arrhythmias, cardiac arrest, and other life-threatening conditions. The IV equipment section includes IV lines, fluids, catheters, syringes, and tourniquets. This setup allows us to establish and maintain IV access rapidly, administer fluids, and deliver medications directly into the bloodstream. Finally, the cart features cardiac monitors, such as ECG monitors, which are indispensable for tracking the heart's rhythms during resuscitation efforts. Continuous monitoring helps us assess the patient's response to interventions and guide our ongoing treatment. Overall, the crash cart is designed to ensure that we have everything at our fingertips to act swiftly and effectively when every second counts in emergency situations. Let's take a closer look at some of the essential airway management equipment we use in emergency situations. First up is the bag valve mask, or BVM. This device is crucial for manually ventilating patients who aren't breathing or are experiencing respiratory failure. It allows us to deliver air directly to their lungs when spontaneous breathing isn't happening. Next, we have the endotracheal tubes, or ET tubes. These are inserted into the patient's trachea to secure the airway, especially when they can't breathe on their own. Proper placement is vital to ensure effective ventilation and oxygenation. To assist with intubation, we use a laryngoscope. This tool helps us visualize the vocal cords clearly, making it easier to guide the ET tube into the correct position. It's an essential instrument for ensuring that the airway is secured properly. Finally, we can't forget about the oxygen supply. Whether it's oxygen tanks or nasal cannulas, these are what allow us to deliver supplemental oxygen to patients in respiratory distress. Providing adequate oxygenation is often the first step in stabilizing a patient and preventing further deterioration. All of these tools are interconnected and play a vital role in airway management, which is a cornerstone of emergency care. By understanding how and when to use each piece of equipment, we can improve patient outcomes significantly. Let's take a look at suction equipment. The main purpose here is to remove fluids like blood, secretions, or vomit from the airway. This is crucial because it helps prevent aspiration and keeps the airway clear for the patient. Without this, fluids can block the airway, leading to serious complications. The key components include a portable suction machine, which makes it easy to move around and use in various settings. We also have suction catheters, which are the tools that go into the patient's airway to remove the fluids. And of course, collection containers to hold the fluids once they're suctioned out. Moving on to infusion pumps. These are vital for administering IV fluids, medications, or even blood products. The main advantage of an infusion pump is that it allows us to control the rate very precisely, which is especially important during procedures or emergencies. For example, during critical situations, we often use infusion pumps to deliver anticoagulants to prevent clot formation, sedatives to calm anxious patients, or vasopressors to support blood pressure. These devices ensure that medications are given at the right rate and dose, which is essential for patient safety and effective treatment. Overall, both suction equipment and infusion pumps are fundamental tools in patient care, helping us maintain airway patency and deliver life-saving medications efficiently. Now, let's take a closer look at the temporary pacemaker. Its main purpose is to provide electrical stimulation to the heart when a patient develops a slow heart rate, known as bradycardia, or if there's a heart block occurring during a procedure. Essentially, it acts as a temporary backup to keep the heart beating properly until the underlying problem can be addressed. These devices are used to maintain an adequate heart rate, giving the medical team time to either resolve the issue or plan for a permanent pacemaker if needed. It's a crucial intervention in acute settings to prevent complications from a dangerously slow heart rate. Moving on to the blood gas analyzer, this tool measures critical parameters like oxygen and carbon dioxide levels in the blood. Along with the blood's pH, these measurements give us valuable insights into how well a patient's respiratory and metabolic systems are functioning, especially during emergencies. This device provides essential information that guides our management of patients experiencing respiratory distress or shock. By understanding their blood gas status, we can tailor interventions more effectively, ensuring better outcomes. Both of these tools, temporary pacemakers and blood gas analyzers, highlight how vital real-time monitoring and intervention are in critical care. Let's talk about the intra-aortic balloon pump, or IABP. Its main purpose is to provide mechanical support to the heart. It works by increasing blood flow to the coronary arteries, which are crucial for heart muscle nourishment, and at the same time, it reduces the workload on the heart itself. This makes it especially helpful in cases where the heart is struggling to pump effectively. You'll often see the IABP used in situations like cardiogenic shock, where the heart can't meet the body's demands, or during high-risk procedures to give the heart additional support. It acts as a bridge, helping the heart recover or maintain stability during critical times. Moving on to emergency medicines, these are vital tools in managing acute cardiac events. Antiarrhythmic drugs like amiodarone and lidocaine are used to treat irregular heart rhythms, restoring normal rhythm and preventing complications. Vasopressors, such as dopamine and epinephrine, are essential for maintaining blood pressure during shock states. They help constrict blood vessels and improve perfusion to vital organs. Sedatives and analgesics, like midazolam and fentanyl, are used to keep patients comfortable during emergencies, especially when invasive procedures are necessary, ensuring they remain calm and pain-free. Finally, thrombolytics are powerful medications used to dissolve blood clots during a myocardial infarction, helping restore blood flow to the affected heart tissue and reducing damage. All these interventions, mechanical support with IABP, and emergency drugs are interconnected pieces of the puzzle in managing severe cardiac emergencies effectively. Now, let's discuss some of the key ethical considerations in the Cath Lab. First, informed consent is absolutely crucial. Patients need to fully understand the risks, benefits, and available alternatives before we proceed with any procedure. It's important that this consent is given freely, without any pressure or coercion. Next, patient autonomy reminds us that respecting the patient's right to make their own healthcare decisions is fundamental. This includes honoring their choice to refuse treatment if that's what they decide. Then we have beneficence, always acting in the best interest of the patient. Our goal should be to do good and ensure their well-being. Alongside that is non-maleficence, which means we must work to avoid harm whenever possible. We need to ensure that the benefits of any procedure clearly outweigh the risks involved. Finally, justice plays a vital role. We must strive to provide fair access to cardiac care for everyone, regardless of socioeconomic status, race, or other factors. All these principles connect back to the core theme of providing ethical, patient-centered care in the Cath Lab. Let's delve into the informed consent process in more detail. The healthcare provider has a responsibility to clearly explain the nature of the procedure. This means discussing what the procedure involves, its purpose, and what we can expect as an outcome. It's essential that patients understand why we're recommending a particular intervention. Next, we need to disclose all potential risks. This includes not only common risks, but also rare, severe outcomes like stroke or even death. Transparency here is crucial to help patients make truly informed decisions. We also present alternative options. This could include other treatments, such as non-invasive therapies, or sometimes even choosing not to intervene at all. Providing these options ensures patients understand that they have choices. It's equally important to give patients the opportunity to ask questions. They should feel comfortable and confident in discussing any concerns, and we must answer thoroughly to ensure clarity. Now, moving on to confidentiality in the Cath Lab. Protecting patient privacy is paramount, whether during the procedure or when discussing case details. Every effort must be made to safeguard personal health information. In countries like the US, compliance with HIPAA regulations is mandatory. This means strict adherence to rules that protect patient data from unauthorized access. When it comes to electronic records, we need to be especially careful. Digital imaging and reports must be secured against breaches or unauthorized use. Maintaining confidentiality isn't just about ethics, it's a legal requirement that underpins trust in our healthcare system. Now, let's talk about some of the ethical dilemmas we face in the Cath Lab. First, professional conduct and integrity are absolutely vital. We have to ensure that every procedure we perform is truly necessary. For example, performing a stent for a blockage that could be managed medically might be unnecessary and could expose the patient to undue risk. Ethical practice demands that we only do procedures that are medically justified. Next, end-of-life decisions can be particularly challenging. When dealing with terminally ill patients, we need to carefully balance the desire to prolong life with the importance of maintaining a good quality of life. These choices require compassion and clear communication. Then there's the matter of resource allocation. In times when resources like ICU beds or staff are limited, we face tough decisions about who receives priority care. These are complex choices that must be made ethically, fairly, and transparently. Accountability is another key point. Every team member in the Cath Lab must be responsible for their actions and decisions. This accountability helps us uphold the highest standards of care and trust. Collaboration is also essential. Providing effective patient care means working as a multidisciplinary team, with open communication and mutual respect among all professionals involved. Lastly, staying current through continuing education is critical. Keeping up with the latest advancements in cardiovascular technology and techniques isn't just about staying competent, it's an ethical obligation to provide the best care possible. All these points connect to our overarching goal: delivering safe, effective, and ethical care to every patient we serve. Let's talk about radiation safety and ethics, which are crucial aspects of patient-centered care. One of the main concerns here is minimizing radiation exposure, not just for patients, but also for staff. It's both an ethical responsibility and a practical necessity to keep exposure as low as reasonably achievable. That's where the ALARA principle comes in, ensuring that radiation doses are kept at the lowest possible level without compromising the quality of the diagnostic or treatment process. To achieve this, we use protective measures like lead shields and aprons, which act as barriers to radiation. We also make sure our X-ray machines are properly calibrated and maintained, so they operate safely and efficiently. Monitoring exposure levels with dosimeters is another key step, helping us keep track and stay within safe limits. Communication is equally important. We need to be clear and compassionate when talking with patients and their families about diagnosis, treatment options, and what to expect. Addressing their fears and anxieties before and during procedures is an ethical obligation. Providing emotional support helps build trust and eases their experience. Finally, respecting the dignity of every patient is fundamental. No matter their background, condition, or personal circumstances, treating everyone with respect and compassion is the cornerstone of ethical care. When we combine all these elements, we reinforce our commitment to safety, ethics, and truly patient-centered care. Let's talk about pre-procedure preparation in the Cath Lab, starting with patient assessment. First, it's crucial to review the patient's medical history thoroughly. This includes checking for any allergies, especially to iodine or contrast agents, as these can impact how we proceed. We also want to assess kidney function, since contrast dyes can affect the kidneys, and consider any history of diabetes or bleeding disorders, which might influence the procedure. Additionally, knowing if they've had previous cardiac events helps us tailor their care. Next, we perform a comprehensive physical exam with particular attention to cardiovascular health. This helps us identify any issues that might affect the procedure or need special attention. Then, we review the patient's current medications. Pay special attention to blood thinners like aspirin or anticoagulants, because these can increase bleeding risks. Adjustments might be needed based on the physician's orders to ensure safety during and after the procedure. Moving on to consent and education, first, we make sure the patient understands what the procedure entails, the benefits, potential risks, and available alternatives. It's important they give informed consent by signing the necessary documents. Finally, patient education plays a key role. We explain what they can expect during the procedure, including sensations like pressure or mild discomfort, which are common. Clear communication helps reduce anxiety and prepares them mentally for what's to come. Let's talk about fasting and hydration before the procedure. Patients are usually asked to fast for about 6 to 8 hours beforehand. This helps reduce the risk of nausea and vomiting during the procedure. At the same time, ensuring proper hydration is crucial. Sometimes, IV fluids are given to help protect your kidneys from the contrast dye we use. Hydration supports your kidney function and minimizes potential complications. Next, we'll cover the lab tests and imaging needed. Blood tests are important to check your blood clotting factors, electrolyte levels, and kidney function, such as creatinine levels. These tests give us a clear picture of your overall health and help us plan the procedure safely. Additionally, having relevant imaging available, like echocardiograms, stress tests, or previous angiograms, is essential. It allows us to review your heart's condition thoroughly and plan the best approach. Now let's discuss skin preparation. Before the procedure, the area where the catheter will be inserted, usually the groin or wrist, may need to be shaved. This step helps reduce the risk of infection. After shaving, the site is cleaned thoroughly with an antiseptic solution. Proper skin prep is a key part of infection control and ensures a safe, smooth procedure. Altogether, these steps, fasting, hydration, lab tests, imaging, and skin prep, are all about making sure the procedure is as safe and effective as possible. They help us minimize risks and provide the best care for you. Let's talk about IV access first. It's crucial to establish an IV line at the beginning of the procedure. This allows us to administer sedatives, contrast media, and any other medications that might be needed along the way. Having reliable IV access ensures we can respond promptly to any changes or needs during the procedure. Next, monitoring is key to patient safety. We start by recording baseline vital signs. This includes blood pressure, heart rate, and oxygen saturation. Knowing the patient's normal values helps us spot any deviations early on. We also obtain a baseline electrocardiogram, or ECG. This gives us a snapshot of the heart's electrical activity before we begin. Having this baseline is important because it allows us to compare and identify any new changes during the procedure, which can be vital for patient safety. Overall, establishing IV access and thorough monitoring are foundational steps to ensure a safe and effective procedure. They help us stay in control and respond quickly to any issues that might arise. Now, let's talk about post-procedure preparation in the Cath Lab, focusing on monitoring and patient recovery. First, vital signs require close and continuous monitoring, including blood pressure, heart rate, and oxygen saturation, for several hours after the procedure. This helps us catch any early signs of complications. Next, ECG monitoring is essential to keep an eye out for arrhythmias or other cardiac events that might occur during the recovery period. We also need to carefully inspect the puncture site, look for any signs of bleeding, swelling, or hematoma formation, and apply pressure if necessary to control bleeding. Moving on to patient recovery, bed rest is often required, especially depending on the access site. For example, if the femoral artery was used, patients usually need to lie flat for 4 to 6 hours to prevent bleeding. On the other hand, if radial access at the wrist was used, patients can often be mobilized earlier, but they should still avoid strenuous activities for a few days. Overall, these post-procedure steps are crucial for ensuring patient safety and optimal recovery. Let's talk about some important aspects of post-procedure care. First, pain management is key. If the patient feels any discomfort, especially at the insertion site, administering pain medications as needed can really help keep them comfortable. Next, hydration plays a vital role. Encouraging the patient to drink plenty of fluids helps flush the contrast dye from their kidneys, which is important for their recovery and to prevent any potential kidney issues. When it comes to medications, if the patient is on anticoagulants or antiplatelet therapy, these should be resumed as directed by the healthcare provider. It's crucial to follow the specific instructions to avoid any bleeding complications. Additionally, if the patient is prescribed new medications after the procedure, like beta blockers, ACE inhibitors, or cholesterol-lowering drugs, it's important to explain their purpose and ensure they understand how to take them properly. Altogether, these steps help promote a safe and smooth recovery, aligning with our overall goal of providing comprehensive, patient-centered care. Now let's talk about discharge planning. It's essential to provide clear written instructions to the patient, covering wound care, activity restrictions, and signs of potential complications. For example, patients should be aware of what to watch for, like excessive bleeding, chest pain, or shortness of breath, so they know when to seek help. Next, scheduling follow-up appointments with the cardiologist is crucial. This ensures we can check on their recovery, review the results of the procedure, and address any concerns that might arise. We also need to guide patients on long-term heart health management. This includes recommending dietary changes, encouraging smoking cessation, and suggesting appropriate exercise routines. These lifestyle modifications are key to improving their overall health and preventing future issues. Finally, it's important to educate patients to watch for signs of complications. For instance, they should look out for redness, warmth, drainage, or excessive bleeding at the puncture site, which could indicate infection or bleeding problems. Additionally, for patients with pre-existing kidney issues, we need to monitor kidney function carefully, especially because contrast dye used during procedures can affect their kidneys. Overall, our goal is to ensure safe recovery, empower patients with knowledge, and promote long-term heart health management. Thank you so much for your time and attention today. I really appreciate your engagement and interest throughout this presentation. I hope you found the information valuable and applicable to your work. Remember, the key points we've discussed, whether it's the strategies, insights, or data, are all aimed at helping you move forward with confidence. If you have any questions or want to explore these ideas further, please don't hesitate to reach out. Thanks again for being here, and I look forward to connecting with you soon.